Cisco Connected Healthy Kids program is a corporate social responsibility program focusing on using the technology and innovation to enable the collaborative children's health care to improve the accessibility to specialized pediatric care. A broad range of technology has been used in our Connected Healthy Kids program, including networking, collaboration, cloud, and security and mobility. And especially we are using a technology called Cisco Health Presence, which really combines the medical device, the high-definition video conferencing together with workflow management software to enable a seamless telehealth program. Cisco started a Connected Healthy Kids program with Lucille Packard Children's Hospital of Stanford about a year ago.
My passion for bringing care into the community started very early in life. My youngest brother was a survivor of pediatric cancer, and we often had to travel into the major academic medical centers in New York City in order to receive care. And seeing telehealth as a solution to something that I grew up with is a wonderful way to have an impact on medicine. Here in Northern California, there are very few pediatric specialists, and as a result, our catchment area is fairly large. Oftentimes, it's 2.5 hours in commute both ways, which is time that I could spend actually seeing patients and delivering care. Telehealth is the perfect solution to distant pediatric care. Children have grown up using iPods, iPhones, so the fear of interacting with someone over a video is not there.
There is a very high demand globally for specialized pediatric care. But we have a short supply not only in US but also other parts of the world. In China, the high demand is a major issue in healthcare. We work with the Peking University People's Hospital. The hospital was designed only taking 3,000 outpatients a day. Without increasing the facility and the staffing level, using technology, they can see about 10,000 outpatients now. A specialist in Jordan Capital Amman now can use Cisco Health Presence solution to work together with the remote doctor to jointly diagnose and treat patients who used to need to travel multiple hours to the capital city.
ابني بيعاني من الأكزيما والحساسية، رجعت فيه المركز الصحي اللي احنا تابعين له، فنصحوني أراجع فيه عيادة الجلدية، وأقرب مستشفى إنه مستشفى الملكة رانيا العبد الله، فما في عيادة جلدية، ما في دكتور جلدية، فحكوا لي عن عيادة السيسكو وهي الرعاية عن بعد عن طريق الاتصال مع مستشفى الأمير حمزة. والله تأثيره إيجابي أكيد لأنه وفر علينا كثير، يعني وفر علينا بالمسافة، وفر علينا بالتكلفة، وفر علينا بأشياء كثيرة، فبرنامج حلو يعني وتقنية رائعة يعني إنه متطورة.
الفرحات عمري 7 سنوات، شفت على الشاشة، بدل ما نشوف على العيادة نشوف على الشاشة، وانبسطت كثير وأعطاني علاجات وحكينا مع بعض. انبسطت وانا بحكي مع الدكتور وما في صعوبة، كل أشياء سهلة.
Cisco now is looking at extending the Connected Healthy Kids program globally, especially to the country where the needs is great. Brazil is a great example.
Aracaju é a menor capital do Brasil, tá? Localizada em Sergipe. É evidente que essa distância dificulta o acesso dos profissionais da saúde. E é claro que quando um paciente, uma criança, fica doente no interior do estado, onera bastante o poder público. Telemedicina significa o encurtamento entre a sociedade, a população menos favorecida e a saúde, a área especializada aqui no estado.
That as a doctor, we'll see the difficulties, the suffering of the small children. And if you take chronic disease as a typical disease for children, like kidney diseases, these children need to come all the time to the capital with so many trips to the capital to be treated. If you can diminish these necessities for the children, we are sure will provide more quality of life. So health as a complete situation where quality of life is included, happiness is included.
Children's healthcare also requires a greater collaboration between centers of excellence around the world.
Great Ormond Street is one of the oldest children's hospitals in the world, started in 1852, and it's now the largest in Europe. We're one of the top 5 pediatric research institutions worldwide. There's a lot of Cisco's supported equipment in our building. Those tools allow us to both dial up room to room within the organisation, for example from the operating theatre to an intensive care area, and to deal with referral to and from outside hospitals and communicating with families either on a formal network like this or through a client, a Jabber client, on an iPad. Once the capital cost is up, you have a significant cost reductions, not just for me, but also for the family. They may have to take a day or 2 days off work in order to see me for half an hour. That's an insult really to them. And if I can get as much follow-up information from them by video as I can get in the clinic, I'm not sure I have a moral right to see them here. Collaboration between hospitals is what makes healthcare work. The advent of modern technology like this, particularly since it can also work on mobile platforms, gives people what they want. I have to look at my population of patients now and see that working in a children's hospital where the children are young and their parents are young, they've all grown up with the smartphone, the tablet or the PC. They have no questions about how it works. And so they look to communicate in that way. And I think we as healthcare organisations need to respond to that and deliver the information, the communication and the collaboration on the platform in the way that they want it.
The next step of Cisco's Connected Healthy Kids program will go beyond using telehealth for community outreach. Our goal is to really using collaboration technology to facilitate greater collaboration between centers of excellence to focus on coming up with new paradigm of personalized medicine.